Did you know that 1 in 6 people with diabetes in the world is from India? Succeeding China, India is home to an estimated 77 million diabetics, the second highest in the world. Diabetes is an epidemic in India. Couple it with the coronavirus and it becomes fatal. Besides cardiovascular diseases and hypertension, diabetes is one of the primary comorbidities that one could cause complications for COVID-19. It is known that people with diabetes are more likely to have more severe symptoms and complications when infected with any virus. Hello all, welcome to our podcast, The Prescription on Earshot Media. I am your host, Dr. Karan Thakur. I hope you're all safe and sound. Last Sunday, on 14th November, the world celebrated World Diabetes Day, along with Children's Day, of course. So in our 8th episode of The Prescription, we will deep dive into this very common, yet sometimes poorly understood condition. In this episode, we will be joined by Dr. S.K. Wangnu, Senior Consultant Endocrinology at Indraprastha Apollo Hospitals and a leading national expert on diabetes.
Indraprastha Apollo Hospitals presents The Prescription in association with Earshot.in.
Welcome, Dr. Wangnu, to our podcast.
Thank you very much.
So, Dr. Wangnu, before I get deep dive into the subject of diabetes, COVID, and other related issues around it, I'd like to begin by asking, what is diabetes?
Diabetes is a condition when the body's insulin, which is an important hormone to control the blood sugar, is either not being produced properly or it is not produced at all. If the body is able to produce insulin, but the insulin produced is at a less quantity and is not acting properly at the proper site, the blood sugar starts rising and we call it type 2 diabetes. Contrary to this, if the body fails to produce insulin at all because of the autoimmune destruction of the cells which produce insulin, it leads to the absolute deficiency of insulin, which leads to the development of type 1 diabetes. So these are two broad categories of type 2 diabetes. One is autoimmune, purely autoimmune. The other is because of the lifestyle changes, family history of diabetes, so many other environmental factors which predispose the patient to the development of type 2 diabetes.
And why is this condition such a cause of concern?
Because both with the type 1 and type 2 diabetes is a condition which affects each and every organ of the body. The main important organs affected are right from the brain, heart, kidneys, nerves, and your liver. Like the majority of the blindness, the major cause of the blindness in India is because of diabetes. The major cause of the lower limb amputations, the main cause is diabetes. The major cause of the kidney failure leading to dialysis and transplantation is diabetes. And the major cause of the heart failure and the heart attack is because of diabetes. Because diabetes are 2 to 3 times more prone to get heart attack, a brain attack which is called stroke, and it affects the kidney, nerves and the eyes.
So this is, in a way, the starting point. Diabetes is a starting point for all these complications that can happen later.
Yes, Karan, I will tell you, we have a study done where even at the time of the diagnosis of type 2 diabetes, there were many patients who were having complications like affecting the nerves, eyes and the kidney, what we call neuropathy, nephropathy and retinopathy. In fact, 8% of the females had evidence of ischemic heart disease as compared to the 4% of the males who had history of ischemic heart disease. That means the clock starts ticking even a decade before the patient developed diabetes. The clock of development of the macrovascular or the cardiovascular complication start ticking from the pre-diabetic stage, or I can say 10 or 15 years before the development of diabetes, and you may present with some of the complication at the time of the diagnosis. But in other patients, the complications start developing if you are not under control after 5 years or 10 years or 15-year duration of diabetes.
And you touched upon type 1 and type 2. Why is type 2 more prevalent in India?
Because type 2 is basically a disorder of the lifestyle. If you take the history right from the famine area when the people were not able to find food, there has been transition in the evolution of the human mankind. With the development, economic development, industrialization, with the rapid availability of the food, initially the people who were born in the era of the hunter-gatherers or the famine, they were having genes to conserve energy, which is called thrifty genotype. Now, same genes are present with the modern evolution. When you have abundant foods, lifestyle modification means you have sedentary lifestyle, these genes tend to cause deposition of the calories. And there is a rise in the body weight. So the obesity parallels the development of type 2 diabetes. Because there has been increasing prevalence of the obesity over the years, not only in developing countries but also in the developed countries. So there is a parallel rise of diabetes, now we call it a twin epidemic, diabesity. Obesity plus diabetes, and we are facing a twin epidemic now all over the globe. And India is having the maximum number of patients with the diabetes.
So type 1 and type 2, as you said, they're very different. What are the risks? Are they different for people who have type 1 and type 2?
The complications because of diabetes are almost equal in type 1 and type 2 diabetes. Like there's certain complication which developed early in type 1 diabetes, there's certain complication which developed late in type 2 diabetes. For example, in type 1 diabetes, they may go into acute metabolic decompensation. In normal language, I will say they can go into coma because of the high blood sugar, high presence of the ketones. Suddenly they can go. And second thing, the type 1 diabetes, they may get kidney involvement, eye involvement at an early age as compared to the type 2 diabetes. We have seen type 1 diabetes getting kidney failure after a year or 10 years or 15 years. And if they develop diabetes at the young age of 6 or 10 years, you can imagine what will be the life when they develop all the complications after 10 or 15 years. And they may be still in the younger age group.
So when should I go and get myself tested for getting diagnosed with diabetes, and how do you diagnose diabetes?
The gold standard for testing the diabetes or diagnosing diabetes is the measurement of the fasting plasma glucose, or after taking a glucose of 75 gram, you have to do a 2 hours post-glucose load. If your fasting plasma glucose is more than 125, you are a diabetic, or the 2 hours post-glucose is more than 200, you are a non-diabetic. But if your fasting plasma glucose is between 100 to 125, you are in a category of the pre-diabetes. So there are different pre-diabetes and type 2 diabetes. So if you are the persons who should do that, whether they are diabetic or not, number one, those who are obese, where they are increase in the waist circumference, more than 90 centimeter in a male and more than 80 centimeter in females, those who have sedentary lifestyle, those who smoke, those who take alcohol, and those who don't do the physical activity. These are the risk factor for the development of diabetes, and all these patients, those are obese, sedentary worker, family history of diabetes, increased waist circumference, they should go and check their blood sugar at least once in a year to see whether they have developed diabetes or not. Reason being, majority of the time the diabetes is asymptomatic.
Silent, they call it.
Silent. 90% of the patient, they don't get symptoms at all. Suddenly 1% does the blood sugar, it comes to 50. Wow. He goes into shock. No, I was not having any symptom. I just got my blood sugar done casually. It is more than 300. So we advise all the patients who comes at a risk of developing diabetes should check their blood sugar once in a year. With the fasting blood sugar alone is enough.
Right. And for type 1, for children, how do we diagnose it in their case?
Type 1 is mostly symptomatic because rapid weight loss, despite the child is eating well, the child is not gaining weight, he becomes emaciated, he becomes weak, goes to the loo quite often. Then the parents should be worried to get their blood sugar checked in their child and then they will come to know whether the patient has developed diabetes or not. Unexplained weight loss, going to the loo very frequently, and becoming very thin despite having a good appetite. There may be no family history of diabetes. So type 1 may not be having any family history of diabetes, but once the child has these symptoms, it should alert the parent to get the blood sugar done and come to know whether the child is having type 1 diabetes or not.
So that's very clear, and now we know what we need to do. I'd like to move on now to COVID-19, and you dealt with a lot of patients during wave 1, wave 2, and I'm sure you must be seeing a few patients now, and hopefully not many more. But why was diabetes such a complicating factor for patients who had COVID-19?
See, I will tell you, Karan, the COVID itself causes decrease in the body immunity because of release of certain inflammatory chemicals, what we call cytokines. Diabetes itself is an abnormal immune response, and you have a low both acquired immunity and innate immunity. Innate is the inherent, right from the very
Inborn.
inborn. So both innate and acquired immunity is disturbed. When you are immunocompromised because of the diabetes, you are prone to get any kind of the viral infection. And this COVID virus, because it gains entry into the body through the ACE2 receptors. And you will be surprised to know the pancreas has some ACE2 receptors, which facilitate the entry of the virus into the pancreas, and it basically destroys the pancreas.
So the insulin production.
Insulin production, those who are already non-diabetic and the COVID get infection, the sugar goes haywire. And number 2, because of the decreased immunity, they get all the complications related to COVID at a severe level. Pneumonia may be severe, they may require ventilation, they may require long hospitalization, they may require the use of steroids and antiviral agent, which the normal treatment COVID protocol.
Right. And how can then, if say for example I am diabetic, do I need to take some additional precautions to prevent getting COVID?
Remember one thing, if you are a diabetic, keep your blood sugar under check. Keep your HbA1c, which is the 3 months average sugar, less than 7. If you are able to keep the HbA1c less than 7, 50% of the war is won. Then the chance of getting COVID infection, the COVID infection severity will be less. Mind it, diabetics are equally prone to develop COVID as non-diabetics. But the difference is that if the diabetics get COVID, the severity of the COVID-related infections are pretty high.
Right. So you should do maximum whatever you can to keep this.
To continue monitoring blood sugar, keep your HbA1c less than 7.
And we've heard a lot about, as a COVID treatment modality, steroids were being given. And what impact does that have for a person who's not diabetic?
Yes. Suppose a patient is not a diabetic and he gets a COVID infection. First of all, COVID infection per se may lead to a transient elevation in the blood sugar, which we call the stress hyperglycemia.
Okay.
Number 1. And number 2, in patients who are predisposed to the development of diabetes, they are not diabetic, they are pre-diabetic. Then the COVID infection precipitate the development of diabetes in this patient. So they become diabetic at the time of the COVID infection, that whosoever was coming in our hospital, COVID, we used to do HbA1c in all the patients along with the fasting blood sugar. Because the patient say, I am not a non-diabetic. So when we do the fasting blood sugar, it is slightly higher than the normal individual. Then we tell the patient, this is because of the COVID, and be sure that your HbA1c, though normal, it is in the pre-diabetic range, and in near future you are bound to develop diabetes, so be careful. Even if you recover from COVID, at least for 3 months post-recovery, continue to monitor blood sugar. During recovery, there are even more chances of development of diabetes during COVID recovery.
And for those patients whom you gave corticosteroids and who were diabetic, what is your advice now?
Yes, Karan, you tell the patients were given steroids and those who are highly diabetic, it causes blood sugar to go haywire. 400, 500, 300. So fortunately in our hospital we have the facilities to continuously monitor the blood sugar, and we used to give insulin to all these patients, not through the subcutaneous route, through the IV route, what you call the insulin infusion through an infusion pump. Because control of diabetes as early as possible is very important to reduce the comorbidity associated with COVID. All the patients used to get IV insulin infusion to control the blood sugar within 24 to 48 hours. And even after recovery, we used to send the patient on insulin, not on oral drug, at least for 3 months to prevent the complication during the recovery period.
In 1995, the World Health Organization estimated that 19.4 million people were affected by diabetes in India. They further predicted that in 2025, this number will increase to nearly 58 million. That's 1/6 of the world in total. The revised figures are now 80.9 million by 2030. So, Dr. Wagner, that's a startling number that we have in front of us. What is causing this escalation in India?
If you see India particularly, which is second to the China, it is basically some factors are because of the genetic predisposition. Number one. Number two, we Indians are more insulin resistant genetically as compared to the Western population. And because of that, our typical phenotype, we are thin, fat Indians. That means our body mass index may be normal, but our body fat is more. Particularly the fat around the tummy, which is basically harboring all the bad chemicals for the insulin resistance. And the fat around the tummy is so bad, it causes diabetes, because diabetes is a pro-inflammatory state. So I told you, obesity, genetic factor, environmental factor, and our typical phenotype, thin, fat Indian, is responsible for the exponential rise of obesity. And one thing I will clear to my listeners, India is the only country where there's a paradox. High diabetes this incidence in the affluent societies and in the patient who belong to lower socioeconomic status. Malnutrition and overnutrition both plays an important role for the development of diabetes in developing countries.
And that's why the numbers are so high.
Absolutely.
This year's theme on World Diabetes Day was access to diabetes care. Having such a huge number of diabetics in the country, thousands still don't have access to diabetes care. The International Diabetes Foundation in 2019 estimated that only 10% of the global health expenditure is being spent on diabetes. So, Dr. Wagner, how does one go about taking care of the fact that you're a diabetic?
See, IDF, the International Diabetes Federation, the main logo is the access to the diabetes. Unfortunately, in India, it's a minuscule number of percent of the patients who get a good standard of medical treatment, access to the medical treatment related to diabetes. The problem is mere huge population, number one. Lack of the basic infrastructure in remote areas, in villages, where they have no access to the appropriate care for the management of diabetes. Even the measurement of the diabetes, the glucometers in remote areas, PSC, is hardly there. Government has spent crores and millions of rupees in causing diabetes, kidney disease, a sort of a national health policy. And initially, some of the government released a lot of money on glucometer screening for diabetes in rural areas. But unfortunately, nothing works. So we have to have a war footing. Our private-public partnership. It is not only the public or the government agency who can. We have to have a combined effort, including NGOs, everything, to bring together the education, technology, and the accessible, affordable healthcare to the masses.
Right. So there is also this talk about reducing cost of care for diabetics. So are there any steps being taken in that direction?
Of course, the cost of care of diabetes is simple. Like if you are monitoring blood sugar, there should be cheap glucometers. We should be indigenously built, and the government had produced some glucometers in between, but somehow, unfortunately, could not take up. The medicines for diabetes, insulin, the tax should be reduced. Already some tax has been reduced. It should be made as a life-saving drug, insulin. And insulin should be priced at an affordable prices. Unfortunately, multinational companies who are having a major stake in the insulin market in our country, their prices are so high, so we have to produce insulin at our own R&D. And I'm fortunate to say the Biocon company and the Walcott company are two important companies who have the basic R&D to produce insulin within the country, equivalent to the insulin which is being produced in the US or Europe.
Right.
So we should be Atmanirbhar, as the
Prime Minister has been saying.
Modi says.
Yes.
And these two companies are doing well to produce insulin at affordable price.
That's good to know. And what about the prevalence of diabetes in rural areas? You touched upon that. Is it now getting...
Initially, there was a wide gap between the rural and the urban areas. The urban people were having higher... Now, this wide gap is getting, closer and closer. And recently, we have seen there's an equal number of patients having diabetes in rural and urban areas. So, this divide has come closer now.
Is it because of affluence or is it because
of affluence, because of the changing lifestyle in the rural areas.
So it's a good thing which is actually, manifesting as bad.
Yes, as a bad, outcome.
Right. And I'd like to now touch upon gender because as we know, for most diseases in India, the diagnosis in men is far more, let's say, prudent than it is in women. And somehow we always think that the prevalence is higher, but sometimes it is because diagnosis is done more in men. What is the situation for diabetes vis-a-vis gender?
See, I will tell you. First of all, type 1 diabetes, which is an autoimmune disorder. Autoimmune disorder is pretty common in females. If you see type 1 diabetes, there is a slight difference in the female to the male ratio. Female is getting more common. But in type 2 diabetes, the male predominance as compared to the female. But once the female reaches about the age of 50 menopause, they also start getting diabetes equivalent to the male because of some hormonal changes. But type 1, because it being an autoimmune disorder, which is pretty common in the females, what you see is some of the younger... most of my type 1 diabetes are females.
Right. Type 1, you're saying?
Yeah.
And what about during pregnancy? One hears that that is also causing some bits of transient diabetes.
When you develop diabetes in pregnancy, it is called gestational diabetes. It may be temporary, which goes off after the delivery. But in certain patients, those who have a family history of diabetes and those who are obese, it may persist even after the delivery. That's why we tell all the patient who has gestational diabetes to come for the follow-up at 6 weeks, 6 months and annually to see whether they are remaining normal or they are going to develop diabetes in near future.
But that resolves by itself later?
That resolves by itself.
Okay. But they should monitor themselves?
They should monitor. They should be very careful.
And are there different risk factors for women as compared to men for developing
The
diabetes?
risk factors are the same. But in the women, particularly in the younger age group, those are polycystic ovarian disease, where the patient gets abnormal periods, facial hair growth. And that disease is associated with the insulin resistance. So the female at the younger age, the reproductive age groups, they have increased high prevalence of insulin resistance and they are more prone to develop type 2 diabetes. So these females are at risk. Otherwise, other risk factor, obesity, sedentary lifestyle, family history, they are common in both.
In this section, we'd like to do some myth busting. There are lots of myths that go around WhatsApp forwards on the internet, and we'd like our listeners to actually get it from the experts. So I'll put forward some myths that are there, and I'd like to hear what you have to say about them. So it is said that if you have diabetes, you should completely avoid eating rice.
Absolutely wrong. This is a myth. This is not a fact. Rice can be taken by any diabetic. Only thing you have to see the amount and the calories you get. This is not that it should not be taken. Rice, potatoes, fruits, all things diabetics can eat at a required and the recommended by the doctor, except the direct sugar, like sugars, sweets, ice cream, cold drink, chocolate, they should be avoided. Rest, everything is allowed for the diabetic patient.
And that type 2 diabetes can affect only people who are overweight?
Not at all. It can affect the patients who are even lean and thin, because in India,
thin fat Indian, which is
thin fat Indian,
right,
it is not.
Yeah.
So Indian are thin fat Indian, they are more prone to develop type 2 diabetes.
And diabetes happens only in the old?
No, diabetes can happen at any age.
Does stress play a role in causing diabetes?
Stress plays a role in causing stress hyperglycemia, which is a condition where the blood sugar remains high for a shorter period of time and then it goes away. But if the patient is at risk of developing diabetes, stress may precipitate the development of type 2 diabetes.
I've been diagnosed with diabetes, so I will now do diet control and exercise, and that will control my sugars.
Again, a big myth.
Right.
The fact is that the moment you are diagnosed diabetic, you have to start treatment from the day one, because your pancreas, 50%, more than 50% pancreas is already gone. So people don't think if when they are diagnosed diabetic, the pancreas is already 50% gone. So apart from lifestyle modification, diet and exercise, you have to take drugs to control your sugar. Don't only believe in diet and exercise. That was the thing people used to do about 2 or 3 decades back. Now we are more wiser.
Right.
So treatment start from the day one, aggressive treatment to prevent the complication.
And insulin damages other organs.
Not at all. It's a myth, not a fact. Insulin is the same. It is an elixir of life. It prevents complication. It prevents complication. It improves the body immunity. And the moment your sugars are high, despite taking 2 or 3 oral drugs, switch on to the insulin. Never be hesitant to start insulin at an early stage. Otherwise, you're bound to get complication.
The last myth is that I can cure my diabetes with alternative medicine.
Absolutely not. My advice to the listeners, there are so many myth busters, cure diabetes, diabetes reversal program, so many things. I want to say that these are all commercial gimmicks. Sorry to say that word.
All of them.
All of them. So be scientific. Diabetes once developed cannot be cured. It can be controlled. And the reversal of diabetes, people are listening, it is a short term. Right. If you got an obese diabetic from the very beginning, if you do strict diet control, diabetes can be reversed for a year or 2. What after that? Right. There are a lot of studies going in UK, the direct trial, where the people are becoming a very small amount of calories to see whether diabetes can be remitted. But again, for a year or 2, after that, again the sugar starts rising. So don't believe in this.
And as we sign off, this show is called The Prescription. So what is your prescription for all our listeners to prevent developing diabetes?
Listen, if you are obese, if your waist circumference is high, if you lead a sedentary lifestyle, if you have got any member in the family who is diabetic, or if you smoke, if you take alcohol, please avoid all these things. Have a disciplined lifestyle, small frequent meals. Don't indulge in high caloric dense food, which is the order of the day of the youngsters. Homemade food is the best. Avoid the junk foods. And I'm sure if you are able to maintain the ideal body weight, ideal BMI less than 25, if you are able to maintain waist circumference less than 19 male or less than 18 female, I'm sure you'll be able to prevent development of diabetes. Thank you.
Dr. Wangnu, thank you for coming on the podcast. That was Dr. Wangnu from Indraprastha Apollo Hospitals, who joined us for this episode of The Prescription. Do encourage your friends and family to listen to our podcast on Earshot.in or the Earshot app. It helps our tribe grow, or it helps your tribe grow. Till the next episode, stay happy and healthy.
Indraprastha Apollo Hospitals presents The Prescription in association with Earshot.in.
Earshot, here and now.